I've just had the exam.
Yes.
And I'm just so shocked at how amazing it was, how comfortable I felt, just very, safe, private. It was just very easy, and it got to the root of the problem.
Yes,
Yeah,
it sure did.
So tell us what your findings were.
Yep, absolutely. So, Mary Star, we did obviously your pelvic floor assessment, and what we found was that the skin tissue, the mucosal tissue right at the opening, that's driving the problem. That's where that pain is coming from. I did that Q-tip test, and when I was touching, you're like, ooh, yeah, that's the spot right there. And not only that, but I could see the redness. I could literally see where the skin looked more irritated, a little bit more angry, just unhappy. And the thing is that when I tested the muscles of your superficial layer, they were fine. They weren't painful, they weren't tense, they didn't have any knots or trigger points in them at all, or they just felt like normal muscle. Same thing around your urethra. You had a super strong contraction each side and through the midline, and then your deep layer, because I know you've been having pain with deep thrusting as well. I was able to feel your tailbone, I could feel your cervix, and then I felt all the deep muscles in the pelvic floor, and right side, left side, the hip muscle, obturator and internus, both sides. Everything felt fine and nothing was painful, right? And so then it was interesting because you found that, or you were sharing with me that you feel like maybe the pain that you're experiencing with deep thrusting might be from
the skin.
Yes, exactly. Yeah. So we talked about how for Mary Star's, for her, what she's experiencing, the two top things I like to recommend for what she's going through is, if you're going with a non-hormonal route, to use a really good high quality vaginal moisturizer. My favorite vaginal moisturizer has hyaluronic acid in it. It's through a company called Good Clean Love, and it's I believe it's their Bio Nourish. If it says hyaluronic acid in it, that's the one. I always recommend a spot test first, right into the inside of the vestibule, inside right where the inner labia are, and right the opening of the vagina, to make sure that it doesn't irritate. But I've literally never had anyone tell me that it burned or irritated them. But that's a great way to moisturize the tissues. But the best, in my opinion, like the top tier, the top echelon, is topical estrogen or topical estradiol. Exactly, estradiol cream.
And my women's health doctor had actually even given it to me, and I was like, be using this, but you told me exactly how to use it now, so that's great.
Yep. So I definitely think that this is what's causing your pain. It's not a pelvic floor muscle issue, it's more of the hormonal balance in your body. And because the thing is that when estrogen starts to go down, our vaginal tissues and our vulvar tissues thrive off of estrogen, and so when the estrogen levels decrease, the skin becomes more sensitive, more it can become irritated easier, or even have little
breakdown,
micro tears or micro fissures inside the tissue there, and that can be really uncomfortable and painful. So
and that's just not just with sex, like this is just day to day, like walking a lot or something like that. I've heard that a lot in my over 50 crowd and stuff too. So like I don't want people to think just because you're not having sex or you're single or something like that, this isn't something you can need.
And do you mind if I share a little bit what we were talking about with the bowel symptoms too? So what I was sharing with Mary Star during our exam today, the assessment today, was that there's a lot of interesting, just anatomically wise, there are receptors, estrogen receptors, in the external anal sphincter. And I've worked with women that have fecal incontinence. So in other words, they cannot control their bowels, whether just day to day or when they're running or jumping or whatever it is. And topical estrogen or estradiol to the outside of the opening of the anus or the external anal sphincter can be really beneficial for that as well. And so I've seen in some online forums, I'm part of a couple groups online with pelvic PTs, and I've seen several PTs comment about how they use topical estrogen themselves, and they just do a little swipe back there, at their anal opening, because they know that there's receptors there, and it's just going to help boost the amount of hormonal estrogen that's in that area to really optimize the functions of our reproductive system down there. And our bowel system too.
So awesome too.
All right.
So next steps.
Yes, next steps. So today was Mary Star's pelvic floor evaluation. Obviously, we found a couple things at her hips, especially through the left side. There was some weakness there. I know she's been dealing with some pain, but her primary reason for coming in, of course, was the pain with intimacy. Now, since we determined that it's not a musculoskeletal cause, it's more the hormonal and skin issue cause, then I think the next best steps, as we talked about, are to, talk with the women's health provider and get back on the estradiol cream. I think that's going to significantly help you. And really, in this case, what we found was that yes, it was the The skin was irritated there, unhappy red, kind of angry looking, sensitive. The muscles were fine at the pelvic floor. You had a great Kegel. You had a super strong pelvic floor actually, and you knew how to bear it down, which is super important as well for bowel movements, for delivering babies, for all the things there too. But so next steps really in this case is for Mary Star to start using, under the guidance of her provider, start using the topical estradiol, which is estrogen cream, and then as prescribed, of course, so depending on the frequency there, and then of course for us to touch base to see how that's been helping you. And then as far as your hip goes, you know, coming back in for some follow-up visits to give you specific exercises to work on the strength there, stability, motor control, all the things, mobility as well, so that your hip feels not so stiff, but it's mobile and it's strong and it feels really good and you're having less pain.
Awesome. Thank you so much, Gabi. I'm so excited. I'm so glad we did this. Where can they find you? Because you are worth traveling for.
Yeah. Thank you.
Yeah.
I am located here in Wesley Chapel, Florida. The office is called Bliss Pelvic Health here in Wesley Chapel, Florida. And yes, we would love to see you. The easiest way to find us or get in contact with us is to either Google search Bliss Pelvic Health, or you can go to our website, which is just all one word, blisspelvichealth.com. Or you can reach out via phone call. Our number is 813-993-4212.
Awesome. Thank you.
You're welcome. Thank you.